Hello, my name is Giovanni Ricci, and this is my presentation on adverse childhood experiences and salivary oxytocin in mothers with a history of substance abuse. So oxytocin is a peptide hormone and neuropeptide that is produced by the hypothalamus and released by the pituitary gland. Research has shown oxytocin is involved in regulating various social behaviors, particularly within the maternal-child relationship. These include regulating maternal bonding, parental sensitivity to child distress, the exchange of social cues between a mother and infant, and the facilitation of healthy maternal-child attachment. The role oxytocin plays in pair bonding and attachment has also been shown to reduce the neurophysiological effects trauma has on the brain by facilitating healthy psychological and social attachment, which likely increases resilience to traumatic events. However, research has also shown early childhood trauma may impair oxytocin production later in life through negative feedback mechanisms within the hypothalamic pituitary adrenal axis, or HPA. Despite this growing body of research, the association between salivary oxytocin and early childhood trauma has largely gone unexplored, and salivary oxytocin measures have rarely been used in combination with the Adverse Childhood Experiences questionnaire, or ACE questionnaire, and there has been little research on this association in the high-risk population of mothers of infants with a history of substance use disorders. As such, the aim of this pilot study is to examine the association between ACE scores and salivary oxytocin in mothers with a history of substance use disorders, using novel salivary immunoassay technique that has been recently developed. The sample included 10 mothers participating in a 6-week infant parenting program for mothers of newborns. All mothers were recruited from a local residential treatment facility for mothers with a history of SUDs. Prior to the start of the program, baseline maternal salivary oxytocin was collected using passive drool between 9:30 and 10:30 a.m. to control for daytime oxytocin fluctuations. At the end of the program, participants completed the ACE questionnaire, a 10-item questionnaire commonly used to assess various types of childhood abuse, neglect, and exposure to household dysfunction. After all data was collected, saliva samples were assayed in triplicate using a novel electrochemiluminescence immunoassay method. The assay had a lower limit of sensitivity of 8 picograms per milliliter, and 2 out of the 30 total determinations were below the lower limit of sensitivity. So the results of a Spearman's row correlation found a strong, significant negative correlation between baseline maternal salivary oxytocin and ACE scores, which can be seen in Table 2. In other words, as participants' ACE scores increased, indicating more adverse childhood experiences, their baseline salivary oxytocin decreased. As you may have noticed, the effect size was quite strong, and this overall association can be seen in Figure 3. So this pilot study supports previous findings showing a negative correlation between early childhood trauma and adult oxytocin production. Results expand previous work by demonstrating this association between salivary oxytocin measures and the ACE questionnaire. Specifically, as ACE scores increased, baseline maternal salivary oxytocin decreased, and these variables were highly correlated. This study uses a neat combination of measures that have rarely been used to explore this association before, as well as a novel salivary oxytocin immunoassay. Findings of the present study also suggest this correlation can be seen in the much less studied population of mothers of infants with histories of substance use disorders. So, given previous research on the role of oxytocin in maternal-child bonding and attachment, these findings suggest oxytocin may be one way in which the intergenerational impacts of early childhood trauma can be understood. Specifically, impaired oxytocin production may be a pathway in which the effects of early childhood adversity can be transmitted to future generations. For example, exposure to early childhood adversity likely impairs HPA axis functioning, which decreases oxytocin production later in life. Decreased oxytocin has been linked to impaired maternal-child bonding and attachment, which acts as both a direct risk factor for adverse childhood experiences and reduces the resilience to traumatic events during childhood. This decreased oxytocin production may increase the likelihood of adverse childhood experiences, as well as making their neurophysiological effects of trauma more severe in children of mothers with a history of trauma. This may encourage the continuation of this cycle in new mothers as they progress through life and pass on these risk factors to new generations, with oxytocin acting as a pathway through which this may occur. As for limitations, the main limitation of this pilot study is the very small sample size, which significantly reduces the generalizability of these findings. However, we look forward to addressing this in future research and expanding on these results. Thank you.